Coming up on the Get Lean, Eat Clean podcast.
Just make sure the place where you're sleeping is as electrically quiet as possible. So get your gear out of your bedroom. It should be like a dark sleep cave. There should not be light in there. You ideally shouldn't have your phone in there. If your phone's in there, it should be at least 12, 15 feet away from you. Ideally in airplane mode, but if somebody's got to reach you, keep it as far away as possible from you. Um, you know, I turn off my Wi-Fi router at night. I have it set up that it just automatically shuts off. Before I had that feature, I just had it plugged into a wall that had a red lamp. And if the red lamp was on, I knew that the Wi-Fi router was on, and at night I just flipped it off. But now my one automatically goes off. So just make sure that your bedroom is electrically silent so your body can fully recover.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed Dr. Michael Twyman. He's a board-certified cardiologist who focuses on prevention and early detection of heart disease. He utilizes the best of conventional and functional medicine to get to the root cause of the patient's cardiovascular issues. We discussed his 4 pillars of optimal health, applications of red light therapy, along with ways to prevent heart disease, how to boost nitric oxide naturally, importance of grounding, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Twyman. I know you will too. Thanks so much for listening and enjoy the show. All right. Welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Michael Twyman on. Welcome to the show.
Thank you for having me today.
Thank you for coming on. And Michael, you are a board-certified cardiologist, and I was reading you've had your private practice since 2012. Is that right?
I've been out of practice since 2012 and started my own solo practice back in 2019.
Got it. Not too many people are opening up their own private practices anymore, right?
No, I'm definitely a unicorn in that aspect.
What got you into learning about the heart and just going down the road of cardiology? And I know now you're into biohacking and things like that. What sort of led you down that road?
So I pretty much wanted to be a physician since I was in the 4th grade. I just didn't know which kind. And then medical school, they expose you to different specialties, and you kind of figure out like what you might like. And then you do some more rotations and really dialed into cardiology, pretty late into my kind of 3rd year of medical school. Just fascinated by how the heart works. And just, the day-to-day was never boring. I mean, you had emergencies, you had, procedures to do, you had imaging to look at, you had office visits. So it was all fascinating to me. And, eventually kind of got more interested in the prevention side of things. So a couple of years ago, I decided to focus more on that.
Okay. So are you doing like less surgeries now and more just on the preventative side?
Yeah, I stepped away from the hospital life and back in 2019. So I've not stepped back since that time. So no invasive procedure, just all consultations and some non-invasive testing we do in the office.
Yeah, and that's got to be unique in its own sense, and because to go from that, then go on to the preventative side of things, was this sort of a you're putting a lot on the line there. Was that a nervous sort of adventure that you started?
Yeah, definitely.
Yeah.
I had some business background when I was in the military. I got my MBA because they decided to make me in charge of the whole department when I was like 28 years old, and figured like maybe I should learn some business skills. So had some entrepreneurial bent in me, and then eventually figured out enough kind of coaching from some smarter business coaches than myself, who kind of said, okay, this is the way to kind of go out there and launch it on your own. So and haven't looked back since that time.
And what did you learn from just doing surgeries and being in the hospital to your practice now that helps a lot of the patients?
Sure. I mean, it's night and day what I do now, but I think it is very useful because I could see the worst cases. I've unfortunately had many patients pass away in front of me or suffer major heart attacks that we had to kind of rescue from the brink of death. So I know how bad it can get, and then you can come reverse engineer and say like, well, if we had you 10 years before this, you'd never be here on our cath lab table, or you wouldn't be here in the ICU, wishing you had met me 10 years earlier.
And what are some high level things that people can do just as far as preventative, so they're not necessarily going down that path that you mentioned?
Yeah, I'm a frequently joke that, you don't want to meet your cardiologist on the way to the cath lab. I mean,
Mm,
yes, I'm a little bit of an anomaly. If you have a very good primary care doctor, they can, focus on some of these same things. You don't absolutely need a preventive cardiologist, but it's more complicated than just, do you have quote bad cholesterol, which is a term I really dislike using because there's no such thing as bad cholesterol.
right.
And, if you get to a cardiologist and you have symptoms, well, you're down the pathway of they're going to do a stress test on you. If it's abnormal, they're going for an angiogram. Plus minus, you're going to potentially get a cardiac stent, or if it's worst case scenario, they're going to send you for bypass surgery. So you don't want to wait until you're having symptoms. You want to look way before that. And there's something I always focus on in my practice is looking at endothelial health. The endothelium is the inner lining of your arteries. It's one cell thick. You're able to take out all your endothelium, it'd be the surface area of 6 tennis courts. So it's one of your largest organs that you don't even know about. But from a cardiovascular standpoint, it's the first thing that gets damaged before the plaque starts building up. And this can happen in your teens and 20s. So you have a decent amount of time to intervene before you're going to have a problem.
And what type of markers or tests could people run to sort of get on the preventative thing side of things?
So I usually kind of lump it into 3 buckets. One is this endothelial health. Second is inflammation, oxidation, and the third is the lipoproteins. So the endothelial ones, there's not a lot of testing that you can do at home per se, but the two that you potentially could do is just your blood pressure. If you have normal blood pressure, which generally should be less than 120 millimeters over 80 millimeters of mercury, then you likely have healthy endothelial function. But if you're starting to have blood pressures in the 140s, 150 systolic as a younger guy, that's an early warning sign that something's going on with the endothelium and the endothelial glycocalyx, which is the protective coating to the endothelium.
Mm,
The other thing you do at home, there are different companies that make these little test strips. So for the people watching videos,
mm.
looks kind of like litmus paper. Um, you put the saliva on the strip. If it's white, you have low levels of nitric oxide likely. If it's bright red, you likely have higher levels of nitric oxide. Nitric oxide's the gas that the endothelium releases that helps the artery relax, so that keeps blood flow normal. But nitric oxide basically also acts like a nonstick surface. When there's high enough levels, the lipoproteins, which are ferrying your cholesterol through the system, they don't tend to stick to the arteries, and you don't start that cascade where plaque will start building up if you have healthy nitric oxide levels.
Yeah, you hear nitric oxide a lot of times with like bodybuilding and even like, erectile dysfunction and things like that. What type of things could people do to help, get that blood flowing and create, higher NO?
Sure. So from the non-supplement, non-pharmacological, realm, the best one is exercise. As
Sure.
increase blood flow to your muscles, the blood is going to transduce the endothelial glycocalyx. In English, the blood's rushing down into your limb. It tickles the endothelium. That tells the artery, hey, blood flow's coming, release nitric oxide so we can accept this big volume of blood coming down to this muscle. So that is one of the best ways to boost nitric oxide levels is just, routine exercise. Second one, it's UVA sunlight. Today, it's
Mm.
snowing here where I'm at in St. Louis, but even today, there's UVA, waves that make it through the atmosphere. So when UVA wavelengths hit your skin, it will liberate nitric oxide from your blood vessels on the surface. So this is one of the reasons why your skin starts turning pink initially is because nitric oxide is getting released and you're vasodilating the arteries. So that's a free one is sunlight on your skin. And then from a dietary standpoint, it's the dietary nitrates. Those are mostly commonly found in dark leafy green vegetables. Also, beets will have nitrates as well.
And yeah, you mentioned sunlight. I know you've gotten just exploring your webpage, you've gotten into uh, photobiomodulations.
Correct. Yeah, mouthful. Yeah.
Yeah, it's a mouthful. I had to practice that one. What type of applications, and maybe explain people a little bit about red light and how that can apply to this?
Sure. So photobiomodulation, using light therapy to change your biology. So it was initially discovered in the 1960s. Accidentally, they were trying to study cancer in rats, and when they actually were using these red ruby lasers on these rats, they were growing thicker coats of fur,
Hmm.
and that was the first use case was hair regrowth. But now there's hundreds of use cases for light therapy, red light therapy specifically. Um, and from a most use case, it's mostly musculoskeletal. So athletes will use this before they exercise. They precondition their muscles with it. It puts energy into your mitochondria, the organelles in your cells that make ATP. And if you have more energy, you're able to go longer. Doesn't necessarily make you stronger, but you generally have more endurance. And then the other best use case for it is, post exercise. It just helps decrease inflammation, decreases pain. And so people have decreased delayed onset muscle soreness. So they recover faster. They're able to go back and hit it hard again sooner. So a lot of the professional sports teams and Olympians are using these type of devices.
Is this something you use on a daily or weekly basis?
I personally use it daily.
Mm-hmm.
I'm kind of a biohacker nerd, so I have a lot of these devices to my access. So I have portable ones. I have half size ones. I have an 8 foot tall one in my office. Researching potentially getting a bed type of device, but you don't need all of these things. You can get by with a $200-300 panel, and that works for most people. So you just kind of spot weld whatever you want to be treating with those type of panels.
And other than, I don't even want to say it again, other than red light therapy, what else do you use? I've put a infrared sauna in my basement. Do you use any hot or cold therapy for yourself?
Correct. Yes. The sauna use is, even in conventional cardiology, they understand the benefits of sauna therapy. Has a much bigger culture in Japan and Finland, obviously, but the data is pretty strong, especially on the Finn side. There's a study that came out a couple of weeks ago that showed that men who were using saunas 3 to 4 times a week for at least 20 minutes of kind of like a rolling sweat, they had upwards of 40% less heart attacks than people who did not use saunas. And there's multiple reasons why this is likely beneficial. The main ones are that it's going to help with, basically it acts as like exercise to the body. You're increasing your heart rate. It'll help your body produce nitric oxide. You're going to have, detoxification happening. So you're going to sweat out heavy metals and plastics you've been exposed to. It's going to activate heat shock proteins. Those proteins go then and fix other proteins that have been damaged. And then kind of more the quantum biology nerds, it's going to improve the exclusion zone water that surrounds your cells, the structured water. So the infrared light expands the exclusion zone, and that exclusion zone water is another repository for energy. So it's not just about ATP, it's the water in your body storing it as energy.
Yeah. So sauna, great benefits. Do you do any cold therapy? Anything with
Correct.
cold?
So I didn't get into that part. In 2 weeks, I'm actually going to Finland,
Oh my God.
Northern Lights, and there's access to go jump in the Arctic Ocean. So I'm gonna definitely partake in that. Cold
That's
therapy
cool.
is beneficial. Even in conventional cardiology, we used it. Targeted temperature management is what it was called. So if a patient, much like that Buffalo Bills player who had his sudden cardiac death event on the field, I'm not 100% sure they did this to him, but it's likely they did, is you usually will cool patients down for the first 24 hours after they have a sudden cardiac death. That slows the metabolism down, it decreases inflammation, and there's been data that it helps improve neurologic function. So anybody who had an out of hospital cardiac arrest, we would either do these cooling blankets or these intravenous tubes that would put cool saline through their system and cool them down for over a day or two, and then you warm them back up, and they usually did better. So there's definitely benefit in the conventional world, but kind of the biohacker way to do it, it's boosting dopamine, it's mental toughness, decreases inflammation, and again for the kind of the quantum nerds, it helps the mitochondria by decreasing the respiratory proteins. Basically shrinks them closer together so that you can pass electrons through them faster. So the faster you pass electrons through your mitochondria's respiratory chain, the quicker you make energy.
Yeah, I've also put a cold plunge in although living in Chicago and you're in Missouri, so you're got cold weather as well. You could definitely just go outside right now and lay in the snow.
Correct. Yeah, you don't need one of these fancy plunges.
Right.
You can just do cold water, exposure in your shower, bathtub. Shower is actually pretty hard because of the air. You have uneven distribution of the temperature. But for somebody who's just starting out, just go outside with less clothing than you would normally put on, and then when you start getting cool, you head back inside, and then just build up your tolerance. Then.
Now, it sounds like you've gotten really into the biohacking side. What sort of led down that road? Is this something that you apply in your practice now for your patients?
Now. Yeah, and for those watching the video, I'm wearing the Hallmark biohacker, blue blocking glasses. back in 2017, I was taking a long trip over to Asia. One of my hobbies is kind of international travel.
Mm.
And that was like a long trip. It was a 14-hour flight from St. Louis to over to Thailand. And we're actually going to do another hop over, the day after that to Bhutan, which the world's happiest people reside in Bhutan. And
Oh,
most people may not know exactly where Bhutan is located, but it's sandwiched between China and India. But I knew the jet lag was going to be pretty significant, flying that far. So I knew a little bit about melatonin and some other things, but to start researching, well, how can you help mitigate jet lag? And came upon some articles talking about these blue blocking glasses. And I didn't really read the articles too much. I just bought them, wore them on the plane, and I always looked insane on the plane. I had the hoodie on to block all the light. I literally looked like the Unabomber sitting on the plane. And they didn't kick me off somehow. And then
yeah.
when I got over to Thailand, the jet lag was present, but in my estimation, it was maybe about a third as bad as it should have been. And so then I had a great trip. And then when I got back to the States, I just really went deep down the rabbit holes. Okay, how did that actually work? And then stumbled upon circadian biology. And then, one thing led to another, and, got into red light therapy and just keep stacking all the biohacks that I learned.
Now, did you say you ended up going to Bhutan?
We did. Yeah, it was excellent.
What did you learn? Like you said, the happiest place on, what is the happiest place on earth?
Happiest people on earth.
Yeah.
Now, sometimes it goes back and forth. I think the Finns are also pretty happy, but partly I think it's just that there's still a strong, historical culture that they had there. They were, I think, the last country on earth to actually get television. I don't think they had television until like the mid 80s or maybe even the 90s. So it's just, stepping back in time, it's another worldly type of experience. And, you were treated like family when you got there. I'm not Buddhist, but it was a very peaceful place to be. So if you ever have access to, going to Bhutan, it's definitely worth the haul over there.
Yeah, I always thought New Yorkers were the happiest people in the world.
Yeah, I'm sure. Yeah.
I've heard you talk about grounding, and maybe explain to the listeners a little bit about grounding. This is something I probably don't do enough. I mean, granted, now it's not that great to just walk outside, but I guess you could just ground by putting your hands on a tree.
Correct.
Right. So maybe explain to people about grounding and how they can use that.
Sure. So before, we had shoes with rubber soles, we were always pretty much connected to the earth. Every other animal other than us is generally connected to the earth and sleeps on the earth or sleeps in the tree connected to the earth. So the earth is negatively charged. The earth has more electrons than you do. So when you're standing on the earth with, bare hands, bare feet, the flow of electrons goes from higher source to lower source. So they flow into you. So electrons, they help, lower inflammation. They help get into your mitochondria so you can make energy out of those electrons. It will help thin your blood. It's called your zeta potential. So you want your blood to be like red wine, not so much like ketchup. When you're not connected to the earth, your blood tends to get stickier. So this helps thin the blood naturally. It's anti-inflammatory. It helps balance your autonomic nervous system. So you have a fight or flight response, your sympathetic branch. You have your autonomic side, your parasympathetic, your rest relaxation response. So when you're standing on the earth barefoot, you're activating that parasympathetic side. So many people, if they've had the experience, if you go to the beach and, you got your feet in the sand, you may notice you're not really that hungry. You probably eat less food those days because you're literally getting energy from the earth. You don't have to then eat the energy from food sources then.
That's another way of saying it. I'm curious, what do you do to ground? Do you believe much in these grounding mats, or do you think that's a little bit?
You got to be a little bit careful with them depending on what you're putting them into, because if you don't know if your own home is grounded, then you might cause some issues actually attracting non-native EMF to you. But if you have a grounding mat and it has a copper wire and it's out your window into the ground, I'm not opposed to that. I don't personally do that at this point. My own experiences, I was using a grounding mat for a couple of nights trying to sleep and had really, really weird dreams personally. And I don't usually have weird dreams. So I was like, I'm gonna stop using this. But when I'm outside, barefoot as much as I can be, or I have different shoes that have copper plugs or other transducing materials, or just go old school. You can wear leather soled shoes and you're still conducting through them then.
Okay. And, just getting back to the preventative side of things, what kind of, I know you talk about a little bit on your YouTube channel, like you talk about 4 pillars of optimal health. Perhaps maybe we'll touch on those. Those are great things that come up a lot on my podcast. I know you mentioned stress management, HRV. Perhaps maybe talk about HRV a little bit and stress management and how that can be, a preventative way to avoid having issues down the road.
Sure. And thank you for bringing it up. Yeah, I usually kind of talk about with my patients that there's 4 pillars of optimal health. And if you ignore one of them, the stool sometimes is going to fall over. So everybody tends to, initially gravitate towards nutrition and exercise. And I don't people, they're not that they're not important, but there may be number 5 and 6 down on the list important things to talk about. So, one pillar is stress management. The second other one is sleep. So the stress side of things, everybody has stress. Everybody has physical stress when they exercise. Everybody has mental stress, but how well do you bounce back from it is really the question. I'm in a high-rise building, there's a highway behind me, and I usually use analogies. If you get cut off in traffic on this highway, everybody kind of gets pissed off initially, but you're still pissed off 4 hours later, still talking about it. Okay,
right.
That's a problem. So how fast can you basically pull down that sympathetic tone and ramp up the parasympathetic tone? And one of the things you can do to kind of measure that is your heart rate variability. So heart rate variability is, the nerdy way to say is the R to R interval on an EKG. It's measured in milliseconds. So it's the distance between consecutive heartbeats, and it should change as that autonomic nervous system is being stimulated. So it's kind of like your early warning sign. The more variable your heart rate variability, the better you're able to handle that stressor. So there's different devices that can measure the heart rate variability. I've tried multiple of them. The one thing is that they tend to rhyme, but the numbers generally are not the exact same. I've tried being the biohacker and wearing 2 or 3 monitors at the same time, and the numbers are different. They tend to rhyme. So just pick whatever device you're going to use and look for your own baseline heart rate variability. And if it starts dropping 10, 20% from your baseline, then you got to look into it. Are you overtraining? Are you getting sick? What else is going on that's kind of breaking your heart rate variability?
And on that note, is there, because I've tried the Whoop, I've never done like ordering. Is there a certain like wearable that you prefer that you think you'd recommend? Or
it really depends on what the use case is for the person. I had the Gen 1 Oura ring that looked like a mood ring. It was ginormous. I had the Gen 2. And then I've tried Whoop for a while. I'm currently using a BioStrap, also a Cardio Mood from Switzerland. Kind of like the BioStrap because it also has your pulse ox. It does some measures of arterial elasticity, which is kind of in my world, early warning signs. Are the arteries starting to get stiff, which can mean you have low nitric oxide levels. So I kind of like this BioStrap right now. But the things that are important to me is that any device that you have on you, personally, I think you should leave it in Bluetooth off mode or airplane mode, because you don't necessarily want your mitochondria that are in your body being pinged by Bluetooth repeatedly throughout the day, especially when you're sleeping. You want your body to be able to recover. So I keep my stuff in airplane mode. It's recording locally, and then I download the information the next day.
Got it. Yeah. I've tried the wearables. I mean, I had the Whoop. I think it was good for, a couple of weeks or a month. And then I was like, okay, I feel like I have a pretty good feel for how my sleep was, how if I've recovered enough. And you talk about like stress management. I usually can tell if I need to like go to yoga or do something, you can sort of tell like just by little things, if little things might just slightly irritate you normally, and they normally don't. You're like, I always think to myself, like, I could probably either do something, maybe jump in the cold or do like an hour yoga class or something.
Right. Yeah, I might think they're useful, but I don't want people to get like, super paranoid that the results are not perfect every morning. There's definitely been studies where they've taken people and blinded them to their own results, and they had actually slept well. They told them, hey, your sleep was horrible, and they went out and performed horribly at basketball practice. And the converse, there's people who slept bad and they said, you did great. And they did great at basketball practice. So, I tend to use the game of like, wear the device and guess what the results are going to be, then look at your data and like, yeah, that correlates. You kind of then eventually, like you said, know when you're kind of, hey, I didn't sleep as well as possible, or hey, maybe I'm getting sick, and you know what the data is going to show.
Yeah, I agree with that. And what about thoughts on like 5G, and do you do anything to gosh, we're surrounded by computers, and I have a few things that I've used, and I guess it's tough to tell if they're working or not, but you got to sort of trust the process, I guess, and trust the manufacturer. What are there any type of, I think the one I've added to my house a little bit, it's called Airs Tech. I don't know if you've heard of that company, that brand. Okay. Are there anything around that you use?
I mean, the inverse square law is the most common thing I use. That's the physics term, is just the further away you're from the radiation source, the less radiation you receive. That's what I use all the time. When I was in the cath lab, we stood away from the
Mm.
ionizing camera that was taking the pictures while we're doing our angiograms. But your question about 5G, it's complicated because there's no consumer facing meters that you can use to say what is your exposure. If you're in a big city, you're being exposed, and unless you're living in a lead lined room, the 5G is getting through your walls and any of your traditional Faraday type cages. So the major issue with non-native EMF is that it opens up the voltage gated calcium channels in your cells, and calcium rushes in. That causes inflammation, causes reactive oxygen species, less energy is made. It's a cell danger response. So, sicker people who have a lot of inflammation, a lot of oxidative stress, they probably need to be more careful with their exposure. If you're, generally a healthy young guy, great energy levels, great sex drive, great sleep, it's probably not affecting you as much at that point.
Okay. I do have like my phone right here. There's something called Safe Sleeve. It's a nice company. They make a bunch of different, covers, I guess that will block the 5G from the phones. So
Possibly, but
possibly.
I mean, I mostly, with the phone, the trick is, talking to it when it's in like speaker mode, or using an air gapped headset, so that it looks kind of like a stethoscope. There's an air tube, and then there's like the speakers below it. And then my office, home, everything's Ethernet, so try to hardwire everything. So you just have to kind of like do the big actors. If you're only doing one place, just make sure the place where you're sleeping is as electrically quiet as possible. So get your gear out of your bedroom. It should be like a dark sleep cave. There should not be light in there. You ideally shouldn't have your phone in there. If your phone's in there, it should be at least 12, 15 feet away from you. Ideally in airplane mode, but if somebody's got to reach you, keep it as far away as possible from you. I turn off my Wi-Fi router at night. I have it set up that it just automatically shuts off. Before I had that feature, I just had it plugged into a wall that had a red lamp, and if the red lamp was on, I knew that the Wi-Fi router was on, and at night I just flipped it off. But now my one automatically goes off. So just make sure that your bedroom is electrically silent so your body can fully recover.
Yeah, and I can't imagine nowadays you see all these people with like the AirPods in their in their ear the whole day, literally.
Yeah. Really
I never wear them, but it can't be good.
No, very unlikely that it will be good. And and a lot of the issues are that because they don't quote heat up, they're not like microwaves where you're going to see immediate cell damage, but it's that low level opening up of the voltage gated calcium channels that's causing the problem. And if people want to go fact check it, go look at the NTP study that was released by the government a couple of years ago. They were using 2G and 3G signals in mice and rats, and it definitively caused heart sarcomas in rats. And rats, have more complicated opsin system than humans do. So if it was causing cancers in rats, it's possible that it's causing it in humans as well. They just haven't done the long-term studies for people. So it's always kind of like the precautionary principle. So if there's more likely to do harm than benefit, you probably want to stay away from it.
And that's the NPT, is that right?
NTP.
NTP. Okay. NTP study. Okay. Okay, so we got stress management, we got sleep, which you mentioned already. Like you said, cool, dark space. Keep electric devices away. Ideally, airplane mode. And the other two pillars. Let's hit on those.
Sure. Which one will you do first? Exercise and nutrition.
Yeah, resistance training.
For sure. Yeah, big part of what I recommend patients now. First start with telling people like what is your exercise time budget? Because I'm not somebody who's a professional athlete. I'm not asking people to work out 10 hours a week. It's what time do you have available to work out? Right. Traditional medicine recommends at least 150 minutes of moderate activity. That should be doable for the majority of people.
For the week.
When I was super busy in the hospital, you just had to prioritize it. It's like I got to the conclusion, it's like if I don't take care of myself and I break down, I can't take care of these hundreds of patients that need me. So you just have to budget the time. There's just not another way about it. But first the pillar is resistance training, because I have a good friend, Dr. Gabrielle Lyon. She focuses on something called muscle centric medicine, and you age better when you have healthy muscles. Your metabolism is mainly driven by how much muscle mass you have. When you're a young guy, you don't put much stock into it. You're able to put on muscle pretty easily when you're in your 20s and 30s. But once you're 40, 50, it's really hard to hold on to it. And it's definitely harder to gain it back if you start losing it. So you have to continually have a battle plan, like, how do I not lose this muscle mass that I have? And that's going to be the resistance training, ideally at least 3 times a week, doing whatever type of resistance training you feel comfortable doing.
Yeah, I'm a big fan for sure. And what about, let's talk nutrition. I know you talk about seasonal eating and timing of meals.
Sure. Nutrition is complicated and there's no perfect diet that everybody should be following. It comes down to, what is that person's goals? Is it weight loss, weight gain? Are they already insulin resistant? I always start with mitochondria. Mitochondria are the organelles in your cells that make energy for you. They're what break down the fats that you eat. They are what break down the carbohydrates that you eat. They break them down into electrons, and then those electrons fuel a process in the mitochondria that makes ATP, water, heat, and carbon dioxide. So you're actually eating for the electrons that's in the food. Mm-hmm. So you inherit your mitochondria only from your mom. So the healthier your mom was and the healthier her mom was, those are basically your starting battery packs of mitochondria. You're going to do better. If they are very sick, you basically have engines that don't have good spark plugs, and it doesn't matter almost how well you eat because the engines are broken. You have to focus on tuning up the engines, and that's through the things we're talking about: exercise, proper sleep, get healthy engines. Then the fuel makes a bigger difference. So I always start with circadian biology. Eating is supposed to be done during daylight hours. That's when your body's primed to digest that information from Mother Nature. So I usually recommend patients eat within the first hour of the sunrise when their local environment is, and stop eating at least 3 hours before their planned bedtime. After that, the macronutrients we can kind of play around with.
Yeah. Yeah. And that can be a little bit difficult, especially if you're in the Midwest like you are, and it gets dark at like 5. But I typically tell my clients the same thing, is like, giving yourself 3 hours before bed to finish that last meal. And
it's all about circadian biology, so that your liver and gut basically shut off for the night and your body starts going into repair mode. So you can do this autophagy. You're repairing the cellular processes that happen during the day. I usually talk about it being like, throughout the day the dishes are getting dirty. At night you put them in the dishwasher, and then in the morning you got clean dishes. Well, if you don't sleep well, you don't have clean dishes in the morning.
Yeah. And do you have like a sleep routine or a morning routine? I'm a big routine guy. What type of things do you like to do to either finish your day or start your day?
I don't have as strong of an evening routine, other than I'm just really good with my light hygiene. I mean,
Right.
my place is very circadian friendly. It looks like a submarine. I mean, I have all sorts of red lights, red light panels. So like my melanopsin receptors are not getting pinged all night. So I generally fall asleep between 9 and 9:30 pretty much naturally. So I usually try to wind down the technology, at least the stimulating ones, an hour before bed. Maybe I'll watch, a Netflix show or something like that for about half hour before bed, but I'm not, reading the news or something that's going to kind of like get you all pissed off and go lay down. But I have a pretty routine in the morning. It's not super like, fancy. It's, I'm up by 5 a.m. I go start the coffee pot, basically heating up, go meditate for 20 minutes, then go make the first cup of coffee, read in the morning time. Right now, reading some Stoic philosophy, read for about 20, 30 minutes. Then right now, St. Louis sunrise about 7:15 in the morning. So usually outside walking by 6 something, outside for 45 minutes or more. And then sunrise, get at least 10, 15 minutes of sunlight in my eyes in the morning time to set that suprachiasmatic nucleus, and then have breakfast, usually a very protein forward breakfast. And then I'm in the office by 9 a.m.
Okay. And yeah, I love the starting with the morning walk. I have a couple dogs, so I'm always up and out. Do you have dogs, or you just go out walking on your own? Okay.
Go out walk with my wife. Yeah.
Okay. And is your wife into all this?
She's gotten into a lot more of it. She definitely likes the cold morning walks with me. I mean, just, it's a mental kind of boost. So she's okay with all the red lights on because her sleep improved after we started doing that stuff.
Yeah. And I know you've talked a little bit about caffeine. What are your thoughts around caffeine and how you can sort of utilize it?
Yeah, caffeine's it's a complicated topic. I know it's in a lot of the bodybuilder stacks and such, but from a cardiovascular standpoint, it's not as simplistic as this. But you really want to know, are you a fast or slow metabolizer of the caffeine? Because if you're a slow metabolizer of the caffeine, it's going to stick around in your system longer and it's potentially going to affect your sleep onset, but it's also going to tend to raise your blood pressure, increase your heart rate. And people who are slow metabolizers, they have increased cardiovascular risk by consuming that much caffeine, more than a glass or two a day. So there's, you can get on 23andMe, you can get through some other genetic companies, but there's a gene called CYP1A2, and it does other things other than caffeine, but it will tell you if you're a fast or slow metabolizer of caffeine. If you're fast, you're generally going to be able to tolerate it without really affecting your sleep. I pretty much, this isn't perfect, but you sort of will know if you're a fast metabolizer because, when I was in college, doing all-nighter studying, you're pounding the Mountain Dew or whatever. And it really never made me not be able to fall asleep. And so I don't currently drink caffeine past like 9, 10 a.m. most days. So it wouldn't bother me if I tried it in the evening, but you really want to know if you're a fast or slow metabolizer. That determines if caffeine's good or bad for you.
Yeah, and it's funny you mentioned Mountain Dew. Isn't it crazy what you used to drink back in the day?
Yeah, I used to have a soda machine in my house at one point. I mean, I was an addict. So
Oh, really? Wow. Uh, let's talk a little bit about supplementation. And are there certain supplements that you like for yourself or that you recommend?
So it's kind of a broad topic, and
Yeah.
it's more based off of the individual who's sitting in front of me. But it's in the name, supplement. Are you supplementing what is already going on in an optimal lifestyle? So if somebody's already eating clean, they're already exercising appropriately, they've managed their stress, they're sleeping their 7.5, 8 hours a night, and then they still have deficiencies, then that's when you start talking about supplementing things. But I always do it based off of blood work and other testing. Again, back to the kind of three buckets, from a cardiovascular standpoint, do you have endothelial function that's optimized? That's mainly about nitric oxide. And there's different companies that make supplements that can help augment nitric oxide if you have low levels. Then inflammation, there's different things, omega-3, curcumin, those are some of the bigger ones I use to lower inflammation. And then lipoproteins, sort of depends on what's going on with your arteries. If you have a lot of plaque in your arteries, you already had a heart attack, already had a stroke, you got a stent, then you got probably, consider using pharmacological agents to really kind of put the fire out in the arteries in that case. So it's always individualized to the person who's sitting in front of me. But, for the people who are going to supplement, quality does matter. If you go down to your local drugstore and just buy what's off the shelf, you really sometimes don't know what you're getting. You don't know how well it's going to be absorbed. You don't know what other things might be in it. If you don't want to have, drug or drug supplement interactions. So you have to know, from a high quality source, why you're taking something and, for how long. Is this to, fill you back up to baseline, or is this something you're going to be taking for the rest of your life?
Yeah, and I know you talk about boosting nitric oxide. You mentioned dark leafy greens. Did you also mention what was it? Beet. Oh yeah, beet. Yeah, like beet juice or beets in general.
The juice is a little bit more complicated because there's probably a lot of sugar in some of the over the counter preparations, and so if you have issues with insulin resistance, you're probably going to want to avoid those type of processes. But it's a little bit complicated with some of the oral nitrates because it really comes down to, do you have healthy oral bacteria? One thing you want to avoid is using the really astringent mouthwashes. The mouthwashes basically nuke and kill all the good bacteria in your saliva that break down those nitrates. And then a lot of people also get stuck on the proton pump inhibitors, the medicines, the purple pills and stuff like that block acid in your stomach. Well, you need acid in your stomach to break down proteins. You need acid in your stomach to be able to make enzymes to make these reactions happen. So if you're pounding, the acid levels down, you're probably going to have low nitric oxide levels.
Okay, that makes sense. And yeah, got it. Is there anything else that we missed?
I'd say what testing you should consider. I mean, I can kind of bang them out real quick, but like I said earlier, if you go to a conventional cardiologist with symptoms, they're going to do a 12-lead EKG and they're probably going to do a stress test on you. And if stress is abnormal, you're going to the cath lab. But that's kind of late to the game. And for people who want to be more proactive and not reactive, you have to look at the endothelial function. There's different tests that can look at that non-invasively. One test is called the max pulse. Basically looks at, are your arteries elastic like an accordion, or are they stiff like a big lead pipe? We have a device in the office called the EndoPet. It basically simulates exercise and tells you how much can your arteries dilate when you stress it with exercise. So ideally, your arteries should triple or quadruple in size with exercise. If you're under like 1.68, so your arteries only dilate 68%, you have endothelial dysfunction and you're set up to develop plaque in your arteries if you don't fix that. Then the next thing is looking at inflammation. There's blood markers that can do it, of course, but we can look for inflammation in the artery on the side of your neck. There's a artery there called the carotid artery. You can have a test called the carotid intimal medial thickness test. It's a CIMT for short. And that will measure the flow. So it only says if there's any blockages in your arteries, but also measure the thickness of the intima. The intima layer should be normally pretty thin. The thicker it is, the more inflammation is in the artery, the more likely ApoB particles, the things that are carrying cholesterol through your blood vessels, they're taking detours and now they're getting stuck in the artery, causing this inflammatory response. And then there's a test called the CT coronary calcium scan. Usually it's about $100 or so. I tell people it's kind of like a mammogram for the heart. Cancer screening generally has it right. You're looking for things very early. A calcium score is kind of looking at, plaque in your arteries before you have your first symptom. Calcium is supposed to be in your bones. It's not supposed to be in your artery walls. So you have calcium in your artery walls, you've had some break-ins, and you have an issue. Then you need to work with somebody who's kind of knowledgeable about this, and they can do the advanced blood work and figure out, okay, what's causing the plaque in you, and then teach you how to kind of mitigate that risk.
Yeah. And I mean, I love what you're doing because I wish there were more health professionals that sort of get on the preventative side of things. Was that something that you thought to yourself, like as you were in the hospitals, you're like almost like a missing link out there for, a missing piece of the puzzle for people and their health is, like you said, almost waiting till it's too late and not getting and being preventative. And so someone like yourself who has the experience of being in the hospital, but now bringing that experience out to preventative health.
Yeah, I mean, it actually started when I was finishing up my cardiovascular training. Cardiovascular training is 3 years after doing 3 years of internal medicine, after doing 4 years of medical school. So it's 10 years of training to be sitting where I'm at right now, plus all the 20 years of experience being a physician. So the third year of fellowship, I was actually thinking I was going to go be an interventional cardiologist, which means I would be in the hospital a lot more of the time, especially in the middle of the night, fixing people with acute heart attacks. And while it's very rewarding to save people at the end, I kind of call it like Humpty Dumpty medicine. Like you're just picking people up, and trying to get them back together. I was like, why don't we just prevent them from falling off the wall in the first place? And back to the four-legged stool, I got a little bit of nutrition training in my, medical school and a little bit in my cardiovascular training, but not a lot. And so I basically kind of stumbled upon the paleo world and then realized that if you change up, certain things and have people be gluten-free, then maybe their migraines and their arthralgias improve. And then one thing led to another. And, you just start kind of just getting more curious. And I think that's really where my benefit was like, I just got curious about if we really looked earlier, we could prevent all this. And while it's great that we can stop it when it happens, in the middle of the night, it's kind of like a never ending process, so I was like, I'm gonna have to step out of the hospital to be able to focus on this more. And that's what I've been doing for the past 3 or 4 years.
Yeah, that's great. And I wanted to touch on another topic that just came to me regarding nutrition, like the myths around saturated fat and how that could be an issue for people. And then also sodium. Maybe touch on both of those and talk about, because I would say, imagine most people are dehydrated and lack and have not enough sodium. And most people think that, having an egg yolk is bad or something like this because of the saturated fat, but maybe explain that a little bit.
Sure. So I'll take the sodium one first. And there are people who are sodium sensitive. It's going to raise their blood pressure. They're going to have more edema or swelling in their extremities. So if you have bad kidneys, you have a bad pump heart, you got systolic or diastolic heart failure, then you may need to be a little bit more restrictive in your sodium intake, but maybe not as tight as some of the guidelines say. But sodium will actually damage the endothelial glycocalyx. So if you damage the glycocalyx, you start down that pathway of lower nitric oxide, arteries get stiffer, plaque starts forming. So you do have to be a little bit careful. You can't ad-lib salt all day long with no side effects. So you just have to test, don't guess, or look at your arteries. If your arteries are pretty healthy with it, whatever sodium intake you're doing is okay. But one trick is when you look at your blood work, when you see on a chemistry panel your sodium level, that's not how much dietary sodium you're getting. That's just what's the electrolyte is in your blood. And if your sodium levels are high on your blood test, it basically means you are dehydrated. If your sodium levels are low on your blood test, it's not that you're not low on sodium, it's that you're basically overhydrated or fluid overloaded, and it's diluting the sodium. So that's kind of the sodium side of things. And then to your other question, saturated fat, yeah, it's a great question. And it is a little bit complicated, but saturated fat for most people is not a major issue. Now, you can sort of know if you have a problem by looking at some blood work, and you can look at ApoE genotype. Your ApoE genotype, you get one copy from your mom, one from your dad. The 3 is the normal genotype. Those people tend not to have as much issue with saturated fat. People have an ApoE4 gene, they tend to have a little bit more issues with the saturated fat. And in my office, I also do a lot of advanced lipid testing. Boston Heart Lab is one company I utilize. They have a panel called the fatty acid balance panel. It will actually give you how well that person's absorbing the saturated fat that they're currently getting in their diet. So I work with a lot of people who are on keto diets or carnivore diets. They come to me with lipids that are sky high. And if they see the traditional cardiologist or the primary care doctor, the first answer is, here's your statin, your lipids are horrible. Where I do a little bit more deep dive and say, like, well, genetically, you're not really predisposed to tolerating this type of diet. So maybe you cut back on the saturated fat. And if you want to stay on this higher fat diet, you're probably going to have to do more monounsaturated fat, olive oil, macadamia nuts, something like that, or polyunsaturated fat, ideally through cold water seafood. So just cut the saturated fat and isocalorically change it to a different fat type. And then often the lipoproteins will start to trend in the right direction in that instance then.
So it sounds like you use a lot with genetic testing.
At least, puts you in kind of the right mindset. Like, is this likely to be tolerated long term? It's back to the kind of the conversation we had before. Like, there's no perfect diet for everybody. So, the keto diet, if you have a really bad seizure disorder and your neurologist says you got to be keto for life, then that's reasonable because the benefits outweigh any risk. But if you're just doing keto because it's cool, you sometimes need to know, what was your baseline look like before you did that diet? Because I've seen a lot of people mess themselves up with these type of diets. It's not evolutionary beneficial to be in ketosis all the time. You evolutionary wouldn't have decided to do that. Where we're at, we got 4 seasons. So it's the winter time. There's not a lot of food growing where I'm at right now. So you would tend to have been more ketotic in the wintertime. You would have eaten protein and fats because carbohydrates don't grow in low light cycles. And then in the spring and summer, when the berries and the rest of the food starts coming in, you would eat more carbohydrates and you would not have been in ketosis. So that's how you got to think about it. Is not only do you eat time restricted during the day, but you would eat more seasonally. It was only past couple, decades that you got blueberries from Chile, in January in Chicago. Like, you just didn't have access to that stuff.
Yeah, very true. And yeah, I mean, I've done the genetic testing, and then there you can sort of plug it in. I think I use 23andMe, and then I think Rhonda Patrick has on her site where you can plug in and get sort of an interpretation of that. Mm-hmm. And I think I believe I was sort of a slow metabolizer of saturated fats, so that is something I've actually cut back a little bit on as well. And then I've also done like some hair mineral testing as well, as far as for heavy metals and to look at minerals in general and see if there's any dehydration or if you're low in magnesium and things like that. Mm-hmm. Yeah, I had an individual on my podcast, Lane, Barton Scott, and Upgraded Formulas. I don't know if you've heard of them, but they do hair mineral testing, and I found it fairly beneficial to learn that stuff.
Mm-hmm, for sure.
So getting to the end, we've touched on a lot of great things. What would you say? This is a question I asked mostly all my guests. If you were going to give one tip to an individual who was looking to maybe get their body back to what it once was, and let's just say in their 50s and 60s, what one tip would you give that individual?
It's actually pretty easy, and it's free. Never miss a sunrise for the rest of your days. It all starts with circadian biology. If you see that morning sun, naked eyes to the skies, that's what my friend Carrie Bennett on Instagram talks about, naked eyes to the skies. That light entering your eyes in the morning time tells your brain what time of day it is. That sets off the cascade of how to make optimal hormones, optimal neurotransmitters. It sets you up for getting proper sleep at night. It helps, with leptin sensitivity. So leptin is the master hormone that determines your body composition. So if you want to have optimal body composition, you need more morning sun.
Love that. I like that also because I do that every morning. And even if the sun's not out, it's still beneficial.
Correct. I mean, the sun changes in its intensity and color throughout the day. So in the morning, there's no UV light. So you're not going to get a burn when you go outside in the morning. That's mostly to help set your circadian rhythm. After, depending on your environment, 30 minutes to 60 minutes, UVA comes out. that wavelength of light, when it hits your skin, nitric oxide gets released. That helps keep your blood pressure normal. And then depending where you're at, we're out of vitamin D winter in St. Louis right now. There's about a 2-month period in St. Louis. It doesn't matter how much skin you expose outside. The wavelengths of light from UVB don't make it through the atmosphere, so you're not making vitamin D on your skin those months out of the year. But otherwise, even on a gray, cloudy day, you're still getting light information in your brain that tells your body what time of day it is.
Yeah. Well, this was great. Where's the best place for people to find you, Dr. Twyman?
Well, thank you for the opportunity to chat with your audience. It's always a pleasure talking with somebody who's kind of like a biohacker, health optimizer. But if people are interested in, the things that I talk about, every Monday night on Instagram, 6 p.m., I do a IG live. Usually the first of the month it's an Ask Me Anything, and it really is Ask Me Anything about cardiovascular health, longevity, biohacking, and I'll answer your questions. And then the other, Mondays typically is a cardiovascular topic. Tonight I'm actually talking about how to optimize your own labs. But sometimes it's a red light topic, or why do you wear these particular types of blue blocking glasses? So if people are interested in that, I'm on Instagram. The name is just Dr. Twyman, DrTwyman. And also my website, it's drtwyman.com.
That's great that you do so every Monday night you do like a Q&A?
For the most part, yep.
Yeah. The power of social media.
Yeah, it's amazing. I mean, I actually call it the Matrix because, I don't like this much blue light technology messing up people's sleep cycles, but I use the Matrix to unplug people to help them understand that there's a different way to look at your cardiovascular health. How do you optimize your mitochondria? So get on there, help them unplug, go see their sunrises.
Awesome. Well, thank you again for coming on and dropping all this knowledge on us. And I really appreciate it.
You're very welcome.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again and have a great day.